Hi, and welcome to the next episode of Complete Physio podcast. I'm joined today by Jake Mulley, who's one of our highly specialised physios at Complete Physio. And today we're going to be taking a deep dive into martial arts, MMA, and all things to do with sort of fighting related injuries. So, Jake, if you just start by telling us a little bit about yourself, please.
Sure. So, graduated as a physio and then went into elite sport, predominantly in football initially. But I've got a background in judo actually. From when I was younger, I was competing on the England squad, and so competed at a high level, and that's what got me into physio in the first place. So real interest in sort of sports and competition, and then therefore injury management in that in that area.
So we're going to go straight in. We're talking. Obviously, it's a massive growth area at the moment, isn't it? A lot of interest. I think probably like UFC, etc. There's a real massive growth interest in sort of mixed martial arts and so forth. And I presume we're seeing that a lot more of these sort of injuries coming through at the moment. Yeah.
Yeah, completely. I mean, it's a real growing area, both from a spectator point of view and then people wanting to give it a go, so at the grassroots level, there's a lot of amateurs trying to give it a go. So there's clubs popping up everywhere. There's a lot more of it, and that leads to an increased number of potential issues as well.
Yeah. So if we can, I guess one important kind of thing to do maybe early on is just to talk about some of those different specialisms, if you like, within sort of martial arts and the sorts of the different types of injuries that we might see there. So,
because I mean, there's so many different disciplines, and between the differences between judo and MMA or Muay Thai, one's very much a grappling based sport in judo, with standing, a lot of groundwork as well. Whereas BJJ or Muay Thai, there's with BJJ, it's much more groundwork dominant, arm locks, things like that. But Muay Thai and MMA, there's a striking element which you don't get in judo. So that lends itself to a lot of different sort of presentations and things. And
So with that said, if we can go through some of the most popular martial arts that we're seeing at the moment. Let's start with judo, because that's where your heart is, isn't it? So what would be sort of the top sort of 2 or 3 injuries that you see generally sort of judo related?
So I'd say the top 3 would be your knee injuries from an ACL point of view, with a lot of pivoting actions, things like that. You also get a lot of grappling injuries, finger, wrist issues from the gripping aspect of it. And then, a little bit more of the sort of lower back issues as well, because you're having to do those explosive throwing actions that lead to sort of a little bit of rotational injury and trauma through the back as well.
Yeah. So, and in terms of, again, if you're sort of rehabbing someone to get back to these particular sports, so if we're thinking here in terms of like judo, how does that impact upon the person's sort of rehab pathway, that whole return to sport element?
Yeah, I mean, it's a good question, because I think having an understanding of the person's endpoint is really, really important. Just knowing the demands of the sport or the action that you want them to get back to doing. So the process is similar regardless of the injury, but then you tailor it to that context. So we know there's a lot of impact actions. It's pretty much split in terms of injuries as to upper and lower limb injuries. So we know that we need to try and rehab them back to both impact based activities. There's a lot of isometric loading. There's a lot of explosive plyometric loading. So there's considerations with that which really, really need you to sort of tailor the rehab process for them, especially at the end stage.
Yeah. I think understanding the sport as clearly you do is obviously very reassuring to your patients, because you have that sort of inside knowledge around the demands of the sport. Would you?
Yeah, definitely. And it's it's also being able to relate to them and let them know that, you know, I've been there and I've done it. I know how that feels in terms of trying to push yourself in the actions that you've got to do. So even just the common language with speaking to them and saying, you know, about this particular throw, and things like that. You know?
And specific anxieties around particular activities within that sport that they might have, you know.
Totally.
Yeah.
You know, I mean, it's because it's a contact sport. There is that anxiety because you're going straight back into sort of quite a intense level action. You know, when you go back in.
Yeah. We talk a little bit about obviously Brazilian Jiu-Jitsu, which is obviously massively popular at the moment with MMA. The types of injuries we're seeing there.
So a lot more sort of elbow and shoulder injuries, actually, as you can imagine.
Funny enough.
Funny enough. Yeah. I mean, you know, especially your sort of dislocations and sort of traumatic injuries with arm bars and things like that. I see a lot of them come into the clinic as well.
Yeah. And I'm presuming some, ruptures of elbow ligaments, which we probably would hardly ever see otherwise.
Completely. And so a lot of ligament sprains and then therefore potentially dislocations at a high level. But the sprains and elbow sprains and things like that we do see a lot of. And it's trying to you see them quite in an acute phase as well, actually. So you see them early doors, which is quite a nice thing to be able to take them through from the start point all the way through to their return to sport, which is really nice.
Yeah. And let's talk about some of the martial arts that involve striking. So the sorts of injuries that you might sort of pick up on there.
So you get a lot of stress responses in the bone. With things like in Muay Thai and MMA, particularly in the shin as well, because of that striking and impact.
Sure.
And then you get your more bony injuries, your fractures and things like that from that. You also get a lot of head injuries from that sort of the striking sports as well. So concussions, things like that, head injuries. So even just contusions and bruises, they can be quite annoying to manage, for the patients or the athletes to manage, because they're just very painful. And if you're going to get striked on that area again, it's quite sore. So so they're all got quite individual sort of presentations and different sort of injury mechanisms that come in. So it's
And we were talking earlier about, obviously your background and your approach, if you like, to sort of injuries and rehabilitation. So you're using sort of strength testing a lot with your martial artists, is that right?
Definitely, yeah. I mean, I like to sort of know what, like we said earlier, about trying to understand the end point of what they're trying to get to. And, so there's a lot of plyometric actions, explosive actions. So we do a lot of strength testing in terms of jumps and hops to test the explosive power that's there. And then I do a lot of isometric testing as well on force plates and like with a dynamometer as well, which give you a real indication of like maximal force and what those joints can withstand. So if someone's trying to bend your arm in the wrong direction, you need to know that it can withstand that force. Otherwise, you're in trouble, right? It's it's quite good to try and get an understanding of some objective data just to guide that rehab process.
And there is some sort of known data, some normal thresholds, if you like, that people should be working towards. Is that right?
I mean, there's not loads of data on that for martial artists, actually. I mean, you've got a lot of data in football, rugby and a lot of field sports, but there's less so in martial arts. So I've started to try and just understand anatomically what those actions might need, and then also use the knowledge that we've got from other sports to try and build sort of a battery of like almost like a fighter's strength diagnostic test that I've tried to develop.
Yeah, excellent. And you're using that with the people that you're seeing, and using that as a way of sort of signposting their rehab.
Totally. And it just helps guide timeframes as well, and gives the patients that I see, regularly in clinic who come in with these injuries, a bit of clarity on where they're at. And it also gives them a bit of reassurance that they are getting better, or the rehab's going in the right direction. And we spoke about that confidence piece, especially with fighters and martial artists. They want to know that they're really ready to go in at that end stage, because it's a pretty brutal area when you go back in to return to play.
I always, something that I find particularly interesting, having these sort of these conversations with physios and real sort of sports specific, and that is, if you like, the culture within different sports and the mindset. So what is really the unique elements with regard to that particular sport? And that's something that you find with your martial artists, I guess.
Yeah, definitely. And all credit to them, but they tend to come in when something's pretty bad. They don't. They won't come in with a little niggle or a little problem. It's usually when something's gone pretty wrong. You know. So otherwise, they tend to just try and keep going, which can sometimes make things worse or rumble on. So, they've got a level of resilience and determination to try and keep going. Almost like a doggedness to really keep going. So, you usually see them when there's a big traumatic injury or something gone on like that. So, their sort of determination to just keep going, and it means you see them sort of when things are sort of probably a little bit more moderate or severe with what's going on. So.
Now, it's interesting. We were talking about this to do with rugby, and we also talked about this to do with dance and performance activities. This sort of culture, if you like, of you just plow on.
Yes.
You don't make a fuss, which, I guess from a sort of medicalization, what we're talking about is underreporting of injuries.
Completely.
And this idea that, sometimes the injury can become quite chronic oftentimes before anyone actually presents with the problem. And that's something that you see with your martial artists.
Completely. And there's a lot of repetitive injuries as well. So, it might not be an issue early doors, but as they repetitively drill these actions, they come in with those things. And I think that's across the board with athletes, and they just want to stay on the pitch, stay in the arena where they're training. And that's the same for your amateur gym goers, everything like that. But it is very much you see them as at the end point. So
and I think also sometimes some of the conditioning work that might be done for like some of the strikes, I know sometimes people are doing conditioning work for striking martial arts. They might be sort of toughening up their hands.
Yes, exactly.
Or toughening up their feet and their shins for kicks.
Yes.
And there's a continuum, isn't there, between when conditioning becomes actually causing yourself a cumulative injury.
Well, exactly. And it's literally about trying to cross train as well, and recognize that you need to prepare yourself for those demands, and and sometimes you can do too much, sometimes you can undertrain as well. And I see a real mix of that. I mean, typically the training sessions for martial artists are very early in the morning or late at night, and very much they'll try and fit in a gym session around that, and you get a lot of overtraining. And also just the recovery element of it as well. You get a lot of people wanting to train repeatedly throughout the week, but not give themselves enough rest period, and that can be important, especially from those bony injuries. You need to give yourself enough time for the bone to regenerate, the soft tissues to regenerate, and just allow everything to settle down.
And we talked as well about the pathway into a lot of these sports now. So certainly that we've seen lots of people taking up MMA, whether it be things like Brazilian Jiu-Jitsu, mixed martial arts, in their 20s, in their 30s, dare I say, even in their 40s.
Yes.
Any particular issues around that you're seeing?
Yeah, I mean, the data and literature suggests that you're more likely to get injured going in as an amateur, and taking it up, and the data also suggests that the later you take it up, the more likely you are to get injured. Which makes sense, but and then it sort of dips as you become less amateur, more professional. And I think people typically go in and rush in and want to try and do everything. And so I typically see a lot more people that have just started out doing it getting injured, and that's just partly technique and learning things, but not knowing their limits as well. We're all guilty of it, right? Whether we try and go out for a run and try and hit a PB, or whether that's trying to max out on a bench press, we try and push ourselves, and but sometimes the body's just not quite got that robustness and resilience to cope with it.
So potentially some more conditioning work and some sort of remedial work required, if you like, if you're taking up MMA in your 40s, potentially.
Completely. And I mean, that's where the strength diagnostic stuff can come into handy, to make sure that not just seeing people when they're injured, I like to see them to make sure that they're able to sort of be able to continue the activity that they want to do and stay doing it. Because they love doing it. It's just, and when people come into me and they're not able to do it, it's tough for them because they enjoy their sport. And we need to try and keep people doing what they love doing. So having that data helps guide a little bit of conditioning work that will keep them, being able to do what they want to do.
And I guess if you are sort of thinking about taking up one of these sort of sports or activities, just being aware of some of the issues around, for example, when you first start training, and training with somebody who, making sure that you have good communication with your training partner.
Completely.
So that you know when to release the pressure on your
Exactly. I mean, you don't want to no, I'm sure no one goes in with the intention of hurting someone, but it's a communication piece, like you said. And even when you come back from injury, going back into training, trying to modify that and selecting your partners, communicating with your coaches, and even just speaking to your physio. And I'm very clear on being able to modify your activity, whether that's more drill based rather than sparring and open bouts and things, which are a little bit less controlled. So it's very important to try and communicate, because the consequences can be pretty sort of severe injuries.
I mean, I've seen some nasty injuries myself, just from people doing pad work, holding the pads. So people that weren't taught how to hold the pads properly.
Completely. So, I mean, and it's, you do get that sort of that improvement as you sort of learn to do it, but you've got to learn the technique and not rush into trying to be an expert at it. And just but even being doing the action and being the partner in that as well is also quite they have different roles and different things.
So just the holds, the position and everything, even down to these like very, very sort of set pieces, if you like, within the training, because what we're talking about is a sport where, as you say, lots of explosive activities, and probably one of the few sports where you're actually, the aim of what you're doing is to hurt your opponent.
Exactly. And there's intention with that, but also not intention. But I mean, it's you're completely right, and that level of impact requires clear boundaries and making sure that the club that you're at is set up to be able to cope with all varying ages, skill levels, everything like that. So and that's where some of the rehab and preparation work is important, especially around warm-ups and that side of things, making sure that you're testing yourself in those positions that you're going to end up in, which you wouldn't end up in sat behind a desk. But then at 7 o'clock in the evening, you're then expected to withhold having been in an arm bar or getting thrown on the floor and getting landed on by someone that's sort of 70, 80 kilos. You have to build up and warm yourself up for those things, So, and that's where I typically on exit when patients recover from their injury, making sure they've got a program that allows them to prepare and maintain that progress that they've made throughout the rehab process, and prepare them pre-training.
And we talked about as well, didn't we? We touched upon the age at which people take up these sports, and I think it's very easy, isn't it, for people to watch, their exposure to MMA. We're looking at people that have been fighting from very young children, being trained and training, umpteen hours a day to be able to do what they do, and realizing that you can't be in a sort of 40-hour-a-week job and then expect to do that at weekends.
No, exactly. Yeah, it's because I started judo when I was 8 years old.
Yeah.
So I've been doing it for 2 decades. So
Yeah.
and you build up that sort of level of skill with that. But like you said, the majority of people's weeks are not spent doing the conditioning work to prepare them for that. And it's very easy, like you said, to just watch the TV and go, I could go in and do that, but not realize the conditioning and preparation that's needed to make sure that you can do it at that level. So it's very important to make sure you build up to that and things from there.
So any sort of particular top tips, if you like, that you would give people in terms of how they can reduce their risk of injury around sort of specific exercises or preparation work that they can do?
Yeah, I really like doing some big isometric holds and things like that to prepare the joints and the ligaments and tendons to be able to withstand those like resisted movements that you're trying to prevent someone from bending your arm in the wrong direction. Also, I think those more explosive movements, jumps, lands, almost those gymnastic type elements, because there's a lot of mobility and flexibility needed to make sure that because you're moving your joints in the extreme ranges of movement, especially in these sports. And then just exposing yourself to the activity, but in a sort of a reduced intensity. So taking your time with your warm up, some lighter throws, getting used to sort of the level of impact, even the striking. Don't go in at, punching and striking straight in at 100%. Build up, warm up those tissues, and things like that as well.
Okay. And we talk about, potentially sort of protective, so if gloves and anything else that you sort of recommend or specific advice you give around, protecting the joints, protecting the hands?
Yes, taping is quite good in terms of trying to, especially if there's previous injury, taping can be effective in that. Some people wear a lot of knee braces or knee pads for the impact, especially if they're doing a lot of groundwork and you're kneeling on your knees, especially if you've got some pain at the front of the knees, some anterior knee pain. Even just a kneeling action can be a bit sore. And the same goes for sort of elbows and shin pads as well, to try and make sure that, that impact's reduced. And it just allows you to be able to do more of what you love doing. So,
And hand and finger injuries, wrist injuries?
Oh, it's really common. People are trying to tear off your grip, when you're gripping. So you get a lot of sort of finger sprains, finger dislocations. I almost think as well, a lot of pulley injuries as well, just from, so similar to climbing, because you are gripping.
Pulleys on your fingers.
Pulleys on your fingers. Finger pulleys. So things that sort of pin your tendons down, and it's very, very important to prep those gripping actions. And a lot of people cross-train with climbing as well to prepare them for the gripping and things. You get a lot of people that are climbers that are very good at judo and gripping and BJJ and Brazilian Jiu-Jitsu and stuff. And I think you mentioned earlier about the age groups and the different ages that come in. I think as you go into it, as you're older, definitely trying to work out that preparation stuff that works for you, and knowing your injury history or areas that you need to develop are really important. So, because as you go through life, you typically pick up the odd bits and bobs that are causing you problems. So it's just trying to make sure you adequately prepare yourself for that. And we want to encourage as physios people to participate in sport, because it's just great for you. But it's about doing that safely and just trying to adequately prepare yourself to be able to keep doing it. So,
yeah. So it's really understanding the nature of the sport, the discipline, and all, and where you're at, particularly with the sort of age thing. And labeling this point, but we know that the sort of entry level age for these sports, can sometimes be quite high, but yet they are hugely demanding sports, and just people being recognizing that, really.
Yeah, definitely. And I'd say that when you're working in an office or you're 40 hours a week doing your job, and you're spending maybe 6 hours a week doing the sport, there might need to be an additional few hours just preparing yourself to be able to do that sport. As it's getting more popular as well, that grassroots base of people going in, amateurs doing it, it's really important to understand, the demands. And I think it's really nice to be able to chat with my patients when they come in and explain to them that I understand that, and where they need to direct their focus in terms of warm-ups and preparation. And that doesn't have to be a long drawn out process. It can be 10-15 minutes, chipping away at it, and it just allows you to mitigate that risk of injury. We all hear about warm-ups and things, and it's no different in grappling sports than it is in football or running, really.
So you mentioned about ACL injury, the dreaded ACL injury.
Yes.
Can you talk to us a little bit about the journey, if you like? If I'm a martial artist and I've injured my ACL, what's the sort of expected journey that for these people?
Yeah, I mean, typically some of them come into the clinic after having done it and not knowing the severity of injury. So coming in for a physio assessment is super important, just to make sure we assess the stability of the knee and recognise how that sort of injury occurred. And then it's about sort of signposting initially around imaging, so whether an MRI is needed or certain types of scans, and then referral to an orthopaedic specialist to determine the pathway. And there's a lot of debate about conservative versus operative management. And I think that's very individual. And that depends on the age, what the person wants to get back to doing, and things like that. But definitely initially it's about trying to settle that joint down, and then start to build up sort of range of movement, strength, drive down the swelling. And initially whether that's post-op or managed conservatively, the process initially is that.
It's a really interesting point that you mentioned there, with regard to the moment when the injury occurs, because obviously there can be so much going on when people are sort of sparring and training. And obviously, oftentimes pain is almost like part of the process of what's happening. So, I think sometimes people can sort of overlook, or, a very quick throw, very quick turn pivot. And certainly, sometimes these injuries can get missed, or they don't necessarily recognise the extent of the injury.
Completely. And, there's the whole adrenaline piece as well, because you're doing a grappling sport, and it's not until the next day that they wake up and maybe the knees double the size of the other side, is swollen and pretty angry, and it needs some attention. Or, they try and walk it off, and, and it's just not getting better, or they notice a bit of giving way over the few days subsequently or weeks subsequently. I mean, I've seen ACL injuries that have not massively swelled up after injury as well. So you've got to be vigilant of those when they come into the clinic, those sort of pivoting actions, rotational actions, and the trauma. So trying to pick that up is really important, because both in terms of the stability of the knee and the long-term health of the knee.
And it's interesting, because I think sometimes, certainly we see it sometimes in dancers, and we see it in, these sorts of scenarios where you say the adrenaline's flowing, there's so much going on, something happens, and then, typically something like an ACL, and it can be quite innocuous, and then people just sense over time something's not quite right
Completely.
with the knee, and then the history doesn't necessarily flag up
Yes.
some significant internal derangement, but the person knows there's something not quite right.
Yeah. And I mean, look, there's limbs flying all over the place in grappling sports, and your leg can get caught up and twisted, and you might not feel it in the moment.
Yeah.
And the number of people I see come in that can't quite recall the moment that has happened, which makes it tough as a clinician, because you're using that subjective assessment and what the patient's telling you to help guide it. But if with lots of things going on, they might not be aware of what's quite sort of gone on, and it's the same with meniscal injuries, which are quite common in these sports as well.
Yeah. Well, there's a paper that is a few years old now, so hopefully things might have changed and things might be improved now. But it was a paper where they said the average time to detection of an ACL injury in the UK was 22 months.
Yeah.
Which seems crazy, because we're so used to, again, if we're watching sport and, someone gets injured and the MRI scan more or less straight away, or somebody, they have a bad tackle, they go straight to A&E and it gets detected. But this just shows you, doesn't it? So many times it doesn't get necessarily picked up at the time of injury.
Completely. And, it goes back to sort of what are people doing for the majority of the week, and they don't necessarily put their knees through that level of exposure that it flags it, and then it's only when they do their higher level actions that they notice something's not quite right, or the knee's not feeling quite right when they're going up the stairs, or they go to turn around, and these things then crop up at a later time. And we know also from the study around the injury burden of ACLs, it's by far the biggest time loss burden in these martial arts sports, actually. So it's one of those things that leaves people out of being able to do what they want to get back to doing for the longest period of time.
And so how long is it before I'm back on the mats again if I do my ACL?
I mean, I go very criteria based, but typically time frame, it's you're looking at that 9 to 12 months.
Wow.
So it's a long old time to build up to that point.
Yeah.
Especially with the demands of those sports.
Yeah.
But again with those strength diagnostics and using a criteria based approach, you can see when the person is able to get back to doing what they want to do based on hitting certain markers and things like that. So I've used a lot of markers that have been well tested around, even things like the Melbourne ACL protocol and other sort of protocols as well to help guide that rehab process.
Yeah.
And for some people, it takes a bit longer. Some people, it takes a bit less time. But
So, just going back to this whole idea of, so if I've got any issues with my knee, for example, and I'm starting to think maybe I've got some sort of internal derangement, whether it be ACL, whether it be meniscal, what things should what symptoms, if you like, should trigger me to go and get checked out, would you say?
Sure, yeah. I mean, because first one would be that sort of swelling, which can tend to happen quite immediately post injury. So if your knee is really, really swollen, I think you need to get that checked, because the knee joint's not happy there. The other things would be clicking or locking of the knee. So if the knee feels like it gets stuck and you just can't quite move it past a certain point. And then the other ones are, if you're walking along or you're doing actions and the knee just gives way.
Yes.
So that can tend to sort of cause a bit of
instability and even just anxieties, that just feeling like it's
completely it doesn't even need to happen. Like you said, it might just be that feeling that you can't quite trust it. And that can be for any day-to-day tasks as well. So it's, if you get in any of those, it's definitely worth getting a check just to see what the stability of the knee joint is like, the health of it, and just to get signposted based on what's going on there.
Okay. Excellent. I'm going to go back up. We're going to go up to upper limb injuries again there, because I just want to talk a little bit about sort of shoulder, possibly neck injuries, anything that we're sort of picking up on there particularly. I guess I'm thinking more now the sort of grappling sort of related sports.
Yes.
Yeah.
And I mean, you're completely right. The shoulder and neck injuries are very high up on that list of time loss injuries for these sports.
Yeah.
And, they don't always have to be those big traumatic ones like your shoulder dislocations.
Yeah.
They do occur.
Yeah.
But also your neck, is very similar to, I'm sure, people who play sort of rugby and things like that as well will know neck strength is so important.
Yeah.
If you're trying to resist strangles and grappling on the ground, you can get a lot of neck injuries, both, whether that's facet joint injuries or whether that's, disc-related issues or muscular issues around the neck.
Yeah. And it's such an important point, because, and again, we see it across so many different sports, so many different disciplines, that people know to strengthen up their legs, they know to strengthen up their shoulders. They stretch their necks. Yeah.
I mean, exactly. I mean, the neck is just like almost the underrated, and forgotten about area of the body when it comes to preparing it for these sports sometimes. And a lot of the top athletes and people that are doing these sports professionally will train the neck intensely.
Yeah.
Because you've got to prepare it for the demands, and whether that's, again, going back to sort of isometric work around the neck, mobility as well, and those things are super important.
Yeah. So you'll get people doing some resistance work for the muscles around the neck, yeah?
Completely, yeah. And it forms a key part of the program if they're getting some upper limb based injuries, shoulder, neck. It's I believe there's some evidence around it helping to reduce risk of concussion, things like that as well. And a lot of that data is in rugby, but it's no different in terms of transferring across to martial arts and grappling sports.
And really the symmetry as well, I believe in rugby, they're finding increasingly the symmetry of the strength of the muscle groups around the neck. So not just always training up one particular group of muscles around the neck, but making sure that you're keeping...
Yeah. Like the balance is so important. And we talk, it's the same at the shoulder and the neck. We're talking about, strength ratios are quite important, particularly around, shoulder, internal, external rotation ratios. And, the same principle can apply around the neck, because we need to make sure that, we've all got dominant sides in these sports. I mean, I'll speak for myself. I'm very right side dominant, which means that I utilize one side of the body a lot more, and the other side gets neglected. But if you need to then use that side, it needs to be able to cope with it. So that symmetry is important, and we'll test for that and rehab that. And some of the rehab might look a bit funny in the gym because not many people are training the neck, like you said, but it's so important if that's the sport you want to do. It's important.
And I think as well, if we're talking about contact sports, we talked about this with the rugby as well, and it's that role that the muscle strength has in shock absorption and deceleration of forces. So if you're getting hit or thrown to the ground, then the strength of the muscles around the neck are also going to be really important in that.
Completely. I mean, you mentioned the deceleration. I mean, when you're getting thrown at speed in judo and getting landed on, whiplash type injuries, the trauma. Also, even in groundwork, the mobility as well around the neck. You're almost, doing rolls and leaning and landing on or near your neck. And so it's that perfect mix of needing mobility and strength through that mobility that you've got as well. And being able to withstand those forces.
So I would say it's definitely something that, again, people probably really need to sort of think about some of these muscle groups that they might not be so familiar with. Like considering and training. And again, we sort of said particularly if they're coming at this in later life, because it's probably something that they will have been drilled in training and coached in training if they sort of take these sports up at a younger age. But
no, definitely. I mean, it's one of those areas that is commonly forgotten about. And when patients come in to see me and I'm talking about training the neck, typically the first thing is, well, they ask is, well, how do I do that? You know, I don't have a clue. I know how to bench press. I know how to train my chest, my back, my biceps, but I don't know how to train my neck.
So what sort of things, what would be a sort of normal progressive neck strengthening program? What sort of things do you get them working with, weights and resistance and stuff?
Yeah, I mean, I typically can start with a lot of band resisted stuff. I start with isometric holds, so things where they're having to hold and brace their head maybe off the end of a bench against gravity. So it's sort of like a sub-maximal isometric for endurance-based things. And then I might get them to do a lot of like rotational-based movements, banded-based side flexion and flexion movements. And then towards the end stage, I might get them actually doing things like bridging through the neck and things like that, you know, because they might need to get out of a hold or be able to escape from a particular position in order to you know, or like you know, particular areas. So they might need to use their head to push and roll themselves over because their arms might be wrapped up or in grappling. So again, it's having that knowledge of what sort of actions and moves are they going to be doing and training those in a rehab setting.
And those movements, they're not happening in other sports, are they?
No, you don't get it. You don't get it in tennis. You don't get it in football. I'd hope not anyway. But you know, it is one of those things that you know, is commonly forgotten about. And if there's one thing I'd say is that, you know, neck strengthening is highly underrated. But highly needed. So it's important to do that. The other thing I'd touch on is the link between grip strength and shoulder function. And, you know, especially in grappling, you know, the need to, you know, look at that whole upper limb chain, you know, not just isolate. If it's a hand injury, don't just think about the hand, think about shoulder function. And equally for the shoulder, don't just think about the shoulder, think about the elbow and the hand.
I mean, this is a really, really interesting topic, and it obviously has carryover into so many different sports. We're seeing, you know, so much sort of, you know, papers coming out on this now, whether it be, we might be looking at, like, as you mentioned before, climbing, we might be looking at tennis, racket sports, this link between sort of grip strength, shoulder. What do we know about it?
So we know that grip strength is closely linked to shoulder function. So a lot of people will find that if their grip strength's low, the shoulder function is reduced. So there's a need to sort of train both, really. I mean, so if you're doing a lot of gripping and grappling, you know, there's a lot of rotator cuff sort of contribution to that. So again, it's about zooming out, and we know that you know, getting some data on you know, some strength data on where the shoulder function is and the grip strength is, which I do commonly whenever I get these athletes in, any upper limb athlete or patient. I try and get, you know, a grip strength measure and get a measure of their shoulder strength, and that helps guide their management. And the number of times I've seen people shocked at their dominant side, or what they thought was their dominant side, actually being weaker than, you know, their non-dominant side, yet they're using it more, is fascinating. I see it quite commonly.
So how much should my dominant side be stronger than my non-dominant side generally? What we're looking for?
Yeah, I mean, I look at it in a certain way. I would say ideally about 5% stronger. The dominant side should be about 5% stronger. However, I would much rather someone be strong and uneven than weak and even. So that's what I sort of term it. So I'd rather you be above the threshold, slightly uneven, because then I know that you're never going to exceed the capacity of what that area needs to withstand. But, you know, as a ballpark figure, you know, that sort of 5%, maybe the 10% at a stretch is where you're at.
Okay. So what we're saying here is, if you are weak around the shoulder, generally, not sport specific, weak around the shoulder, you're more likely to end up with a wrist and hand injury, elbow injury, potentially, because how does that work?
Yeah, pretty much, because because of that link between the rotator cuff and grip strength and its contribution, you know, your grip strength's going to be weaker if your rotator cuff strength is a bit weaker.
Yeah.
Therefore, if you need to then use your hand to grip things, and that's, like you said, in everyday life, it's a key thing, whether you're, you know, gripping things or holding bags and things like that. There's a close link with that. So we know that we need to try and mitigate that risk by sort of managing shoulder strength and grip strength.
Yeah. And there's a lot of coming out now, science research, if you like, looking just generally at grip strength as being like a really important factor with a whole host of different problems, isn't it?
Completely.
How does that work with the whole sort of causation versus how what do we know about that side of things?
Yeah, I mean, it's a tough one to answer, really. I'd say that, and the point you made about its importance just more generally in life is really important as you get older as well, in later life. Yeah. So as you get older, it's such a key function. So I believe there's some data and some papers on that look at grip strength in sort of in older individuals, and that relates to sort of their ability to function and
it's interesting how these things go full circle, because I can remember when I first qualified as a physio 25 years ago and you know, if you sat there doing your grip strength, that was one of those joke things, wasn't it? A patient would say, oh, should I be doing one of my like grip strength,
stress ball or something?
Stress ball. And then you're like, no, get rid of the stress balls, and now it's all about the grip strength.
It is. And you know, I think as we understand more about its function and things, it's then its importance is highlighted. But like you said, it's come full circle, and I think knowing that interaction between the grip and shoulder function, and we know that, you know, even in older populations, shoulder function does decrease, and you know, people pick up rotator cuff tears, injuries around the shoulder, frozen shoulders, you know, things like that you know can lead to sort of reduced function and quality of life as well.
It's a really interesting point, and I like that, you know, you said earlier about zooming out. You know, if someone's getting like wrist and hand and forearm injuries, and we might be looking about, I don't know, racket sports or something like that. But then if it was something even like really more whole body, well, you know, we're talking about martial arts here, but climbers, for example, they might be getting wrist and hand injuries because they lack core strength, glute strength.
Completely. And that's where, you know, considering the actions that they're doing and what they need to do, and that endpoint that the person is trying to get back to doing, and what does that involve from an anatomical and sort of a movement perspective, and then sort of deconstructing that to then form a bit of a plan, and see where there's sort of weakness or issues in that whole chain of events that happens, and within that, the grip strength, shoulder function, core strength, like you said, they all play a part. And that's where I sometimes find that people that come in with recurrent issues, it very much like zoomed in on that one injury site, but not looked at the bigger picture. Exactly
that, isn't it? And it's like, you know, someone's coming in with a recurrent, it might be a hand, finger, whatever injury, but the answer might be that they're weak around the core or around the glutes or something like that. And it's that whole, you know, you'll keep repainting the kitchen wall, but actually you've got a hole in your roof. And that's where it's coming from, sort of thing.
Completely. And that's where I think just having a bit of a real holistic approach to it, and utilizing a real MDT approach as well. You know, for lower limb, I mean, we're fortunate enough to have podiatrists and can grab and have a chat with them about sort of what might be going on, and from a lower limb biomechanics perspective, as well as, you know, orthopedic consultant network. And it's about using that network to sort of build that holistic picture and give the best care possible based on, you know, especially in those recurrent injuries that can just be a little bit annoying and affect quality of life, you know. So we want to try and zoom out and allow people to do what they want to do, but that sometimes requires you zooming out and going, what's the bigger picture here? And injury wise, that requires looking at, you know, things a little bit more globally rather than, you know, putting your blinkers on and zooming in on that one small structure that's injured.
Excellent. So yeah, brilliant. I mean, yeah, some amazing points there, Jake. Thank you so much. So yeah, thank you for joining us today, Jake Mully. And
Pleasure.
And if you've got any martial arts related injuries, I think we know the man to come and see. Yeah.
No, appreciate it. Yeah, no, more than happy to see people with those things and a whole host of other things. And want to try and keep them training and doing what they love.
Exactly.